People always ask me what my favorite scar treatments to do. It's probably going to be TCA Cross. Reason why. Hi, I'm Dr. Qazi. I'm a scar specialist in Newport Beach, California. Let's walk you through a combination acne scar session. I love being really precise with it. I love checking the depth of each individual scar. I place the acid at the base of the scar and I change the concentration depending on how deep each scar is. That's really important. You can see what I'm doing is I'm using angled lighting over here. I'm checking constantly to see if we're going to actually be able to use a stronger concentration or use a more softer concentration of that acid. A lot of times what ends up happening is that I've run into patients who have gotten TCA Cross either at home, they've gotten it from eBay or Amazon, and they've actually gotten some significant scar widening. Sometimes what ends up happening is that the patients actually are getting it done at home and they're splashing around the scars, and it can get a lot worse. That could be a lot more challenging to treat. But if you notice, what we're doing over here is we're really precise at this. And what you may not notice is I am changing the concentration each time for the different types of scars that I'm dealing with. So it's not just a cookie cutter type of thing where you just use 100% on each scar. And I know some places that will just do it like that. They'll just place 100% TCA and go all over the scars with 100% TCA. That can be really disastrous, especially if it's a more superficial scar. And then on top of it, what ends up happening is that people sometimes do it on boxcar scars in the wrong way. When we're using the TCA for boxcar scars, what we want to do is we want to place in the inside walls of the scar to get some scar contraction then. You don't just place it in there, splash it, and hope for the best, because then you can just get some scar widening. You can actually even do some TCA in rolling scars if you do it properly. Again, you're trying to do scar contraction. So it's a process that takes a lot of work, a lot of effort to do properly. High concentration. I love doing it. I do multiple times a day. Really is one of my favorite treatments. I think because I do a lot with sculpting and painting, especially when I was younger, I used to do a lot of that. And so it just really fits into my world. You'll notice also as we do this, we are actually also taking a look and seeing if we have tethering. So when there's tethered bonds, you see the next portion of things here where we place a lot of numbing solution in the skin, and we're going to go inside the scars to actually break up those tethered bonds. So I'm inserting what's called a blunt cannula. What's nice about this is basically this is essentially a process that doesn't cause as much trauma. So I usually do a lot of tumescent or numbing solution, and that's basically helped lift up the scars. Most of my work is actually going to be with a blunt cannula. If there's a spot or two where I feel too much resistance with the blunt cannula, then I may have to insert something, whereas I use a sharp blade just for that local spot. But it's very, very rare for me to go and really widely use a sharp blade. I really don't believe in doing it. And if you also notice, the other thing that I do is I try to make sure that I'm along the cheekbone over here. I don't tend to do much subcision at all in this area because I think you can run into a lot more problems. If I'm going to do anything over there, it's going to be very light, which is some blunt cannulas over there, just mildly, just to break up that scar tissue really meticulously, just in each individual scar. So it's a process that you have to be very, very careful with. But fortunately, again, I do a lot of it. To top it off, I use a strong laser. In this case, we're using a CO2 laser. This is fractionated. You can see those little gaps, those grids over here. Now, a lot of times I combine a fractionated CO2 laser with an ablative CO2 laser to really smooth down the edges of the scar. It just depends. This particular patient, she actually has a lot of ice pick scars. And so the CO2 laser works really well for that.